start and let's go to a webinar to speak about Morpheus8. Now, start.
At last. Welcome to you. As you no doubt have guessed, I am Morpheus.
He's not Morpheus. This is Morpheus8. This is the new RF fractional transdermal device that is few years is out and is the son of Fractora that we had for many years, and so they changed many characteristics about it. And this is for skin tightening, for face, for body, for all the areas where it's needed. Acne scar treatment could be good, and stretch marks improvement, and the skin resurfacing with a new resurfacing tip at 0.5 millimeters. What can you tell me? This is what you see, the tip, and the delivering energy in the dermal space and subdermal up to 4 millimeters is really important. Because with our face tight, usually we do, and with the body tight, we do on the subcutaneous fat, and we go up to 1 centimeters or until to 5 centimeters of the body tight. But we need also to have a contraction, a tightening on the dermal space and on the skin. So that's the idea, is to have all the layers complete with their tightening effort. So we have multiple depths with the same tip. So we have 1 millimeter that usually we use on periorbital, on perioral, barcode and something like this, or we can do periorbital 2 millimeters, we can do on the face of 3 millimeters, and obviously on the body we have 4 millimeters depth. We have a fat coagulation, bulk heating of skin, and no ablative fractional. This is good because the dermal heating, we had with Fractora even the ablative pain, but usually they have the same contraindication that has the laser, CO2. So when we have ablative on the skin, we have a long healing time, we have a redness for a long period, and sometimes there are problems about hyperpigmentation. So now with no ablative, we can have the same results, but no contraindication about this one. We can do a comparison of the fractional technologies, and what I want to show you is that the father, the Fractora, the ablative pin, obviously, I want to show you here, there was ablation and coagulation for dermal heating. But now you can see after Morpheus8 has no ablation, but look, the same long space where it could heat all the tissue. So after you can see the CO2 laser that we used for many years that has only a marginal heating. You can see the orange, not the red one, but the orange has a little area where it can do. It is only marginal heating, it's not spread all over. And albumin YAG and intracell, that is a monopolar, they have no epidermal treatment, there is a marginal heating. So I think the difference is that we can be more spreading our heating. Now, this is not the transformer video. This is Morpheus, and this is profound. These are not transformer, but this is just only one device we have taken just to see what is the difference about Morpheus and the other devices. So first, power. Power is much more than the profound we have taken in our radio frequencies. They call fractional, but maybe it's not so fractional like they talk about it. So then another difference is that we have a pulse repetition rate up to 1.5 per second. So they have, it is really extremely slow. The pulse repetition is 0.2. So, well, another important thing, I don't know if it's important for you, but for me, yes, disposable price. So the tip are really cheaper than the disposable price of the other device. And in conclusion, we can say that they don't have not fractional treatment, and this is the treatment effect is like more similar to Fermi, that is a monopolar RF. Last but not least, subdermal full thickness heating of the skin on Morpheus has not dermal effect in profound. So that's the difference, and this is one that we take. But so it's just not to say this is better, but there difference about the works. This is how it works. So these are the tips. They are going in. They are doing heating just only on the tips. You can see now that just in the tip that is really at the end 0.5 millimeters, all the other needle is insulated. And so we have a bulk heating, and we are doing something in the fat. But this is 4 millimeters. We can do on 3, on 2, and 1 millimeter. And we have a remodeling of collagen, but after we will see after. Now, what we have on the screen in the device is just like the body type and the face type you can use, and there are also dedicated only with Morpheus and Pulse Light. You know, all the panorama, the portfolio of InMode is not my it's not my time to tell, but what is on the screen, usually on all the screen of all the device that have Morpheus8 is this one. First, we have the selection of the depth, and this is very important because we have seen that it is written periorbital or face or body. So we have 1, 2, 3, 4 millimeters. So the selection of the pin depth and penetration according to the dermis thickness is really large. So we can have a big choice of this. Second, we can do one or multiple layers. So usually I do multiple layers sometimes where I can do, because I have much more effort if I don't make too much heating time. So first is depth. We can go with energy. Energy can be delivered from 5 to 60. 5 is nothing, but 60 is too much. So usually, according to the thickness of dermis and the gravity of the creeping skin that we have, starting power usually is from 35 to 45. This is just the average of power that we use usually, but you have a choice. You must choose what is better for this patient, because there are many parameters, something like age, something like skin, something like thickness, and you adjust the energy, and it's preferable to start with less energy, and in the next session adjusting power according with results. So third, mode. It's really important. Mode is cycle or fixed. Cycle needs go in and out each pulse. So the needles go in, release the energy, and go out. So when you have fixed, the needles stay in until foot switch is released. So the selection of mode according with the thickness and with the skin texture, usually face and body needs fixed to improve results, and neck and periorbital cycle because it's a reasonable treatment mode, so it's better because it's less aggressive. But usually you can choose what you want. Anyway, we decide for body and for the deep thickness of a face, fixed mode that is really effective. After, you can select between a single pass with a foot switch pressed or repeat automatically at predetermined time rate. So you choose your choice. This is really not so important. But you have a counter, and the counter of pulses can be resetted every area you are treating, so you are symmetrical. You can do the same pulse from one side to the other side, so this is really important. So you can reset every time. And monitoring number of pulses in one area and total, it's really important for symmetry, but the expectation of in the next step treatment, if you have, you know that you did 25 pulses or total 25 or something else. The next time you will see the results, and you can do more if the skin can accept this treatment, or is do good. If it's too much redness, you can reduce the time. So it's really important to have a parameter so you can do it. This is the Morpheus tip needle structure. As you can see, this is a high resolution photo. Maybe you can see that on the top of the needle here, you can see that is insulated until the end of the tips, and on the top you can see is not insulated. So we have 24, exactly 24 needles that they come out and they go in our tissue. This is a zoom of a needle that is insulated, you can see, and look at exactly at the tip. This is not insulated, and this is 0.5. This is all what we have. Morpheus8 handpiece is delivering RF bipolar fractional energy to a subdermal tissue with energy applied to less or 5% of the total coverage area. So that's why we don't need one treatment, but many treatments. So 2, 3, until 5, but we will repeat this one, because if your patients want to do only one treatment, forget it, don't do it, because it's just a little results, and so this is what we don't know, we don't need to do it. So the energy is delivered to the skin through these coated needles. The coagulation of the skin promotes tissue remodeling, while untreated tissue between the pins promotes faster healing of the tissue. So that's why, because we have fractional laser, fractional radio frequencies, this is because we have much faster healing. Because if you have some tissue untreated between the pins, this is better because it's really faster. If you treat all the skin and not only a part, this is much slower, and we have redness and so some more complication. So that's why the fractional treatment now are winning among the others. So the local injury induced by dermal penetration of the micro needles release growth factor TFG, alpha, beta, VEGF, so many others that stimulate collagen and fiber elastin production, as well as angiogenesis, new vessels. So what you can see that is new collagen starts after 7-10 days, start to remodeling. So really good. What I used in these times, a device for the 3D objective evaluation of the skin texture before and after. It's really important because sometimes if you do only a photo, sometimes if you have not the same light, you must do always the same light, the same. And sometimes some devices are really important to see the difference about the skin. So we can appreciate with many devices now on the market. This is what I have and this is what I use. But the evaluation you can do on many parameters. This is an evaluation of fine wrinkles with 3D, and you can see that after 2-3 months, don't remember exactly because I have the dates, but I don't sign it. You can see that on this side, on the left side, is really where you see blue. Blue is the most deep, the depth, sorry, of a scale. And you can see there are a lot of blue wrinkles, but these are fine wrinkles because until 1 millimeter we call fine wrinkles. You can see on the right that they are less after 2 or 3 months. So this is the first good news. And this is a pore. Well, we can check also the pore. These are the medium pore because we have medium, fine pore and everything. So, but I want to show you some of them. These are the pore, and you can see the blue are less in the right one after 3 months. So that's good, but even because I cannot show very well in some cases the skin, because you know here just on the webinar the photos, the connection are not so good, so it's really difficult to show. And I have chosen some cases that are really impressive, and so you can see even if there is a photo. But this is much more impressive to see because these are the fine pores. You have seen before the medium pores. Now you can see fine pores. And this is really important to see that even fine pores are closing, are going more, they are less and so more concentrated. This is a 3D image about skin, but this is really difficult to evaluate. And what we can do about the recommendation about the treatment. So first, check the skin. It's really important to see if there is a patient with an anamnesis, with a background of hyperpigmentation, of diseases of skin, and even the Fitzpatrick type. So you set different parameters if it's Black people, Asian people, or patients with a kind of skin that has a lot of damages of brown dark spots. For example, Asian skin type 4, 5, 6, Fitzpatrick type must be treated gradually to avoid hyperpigmentation. And usually we start by 15, 20 kilojoules, but it's not ablative, so we cannot have this problem. But I think all the doctors from Asia, they know exactly how to treat after if they have something like this. But if you start very slow and so you deliver less energy, maybe it's better. So even 15, 20s is good, is not so much for this kind of skin. Inform the patients to avoid sun tanning after treatment for 1 month. This is really important. So they must put on sunscreen, sunblock, creams, and everything to avoid sun tanning, to avoid complication. Topical anesthesia. This is the minimum required because the treatment, you know, is painful. But many people, many doctors, many colleagues, when I go around the world, they say, "Oh, I'm doing topical." Well, you are lucky. I don't know why my patients, they don't like pain, and when they feel just a little pain, they say, no, this is not good. I like to do more, and this is why I recommend local anesthesia. But this is not the only question that I'm doing myself when I do anesthesia. Topical sometimes is really not so enough for the depth, but local is also is useful because you are putting on the dermis, on the skin. You see on the picture here, I can show you there are small needles, and I'm treating all the face, all the area that I'm treating, just in the same depth where I'm going, 4 millimeters, 3 millimeters, and I'm putting liquids. As you know, when I'm doing face tight or body tight, I do an infiltration because I have a safety with water, with saline solution. So, and I'm spreading more of the heating because you know that the heat on the water is spreading more. So that's, I think, is my really important thing. I want to spread more heating and I want to protect the skin. So that's why I'm doing local anesthesia. And the second thing is, if I'm doing topical, I need 20 minutes, 30 minutes to wait that the effect is. I get off and sometimes the patients feel pain. If I don't do it, and if I do this one, I need 5 minutes, 10 minutes, not more, to do it everywhere. Wait few minutes and it's ready. So less time, and this is much, much better. Well, another thing is to follow instruction post-treatment, that after I will show you, but sometimes doctor put on the patient some lenitive cream, but we will see after. But you know, follow instruction because sometimes some patients do what they want, and this is not good for the healing. What about the schedule of treatment? Schedule is the number of treatment. Depends on each patient, on the expectation of his patients, on the skin damage, of what is about the skin, and you have the choice to do it. But remember, from 2 to 4 or 5 sessions, depending on the patient's skin condition, are highly recommended. So don't do it only one treatment because it's not enough and this is not good. Even sometimes you can do it. So on some very thin skin, you can do it one treatment, it's just you have a result. And sometimes some patients of mine, they told me, well, it's enough, doctor, it's okay, what I want, but it's not the rule. Don't do the treatments very fast, one each hour. So not before 40, 60 days. Every 2 months is a good rule. Wait, the collagen is starting to work. Wait, the skin is going to heal. Is going healing. Many really important things are working in our skin. So wait. After, when everything is finished, we can start again, because we are doing an inflammation. We are doing a treatment that is doing something that maybe needs to heal. Well, it's really important to apply the handpiece to the treated area, ensuring a contact with pressure to minimize discomfort. But remember, now the last updated software is better with the tip, because now if we don't ensure a contact, we have a noise, a sound like we have in the face tight when there is something wrong, and we know exactly if it's perfect because it's a bipolar, remember. So we must ensure a contact with our tip on the skin, and if it's not so attached to the skin, we have a different sound. So after we press the foot switch and deliver RF energy, we move the tip to a near area, overlapping. Most of us do overlapping because we want to cover more, but don't do more than 50%. And sometimes we need to apply 2 passages if you use cycle modes, and 2 stacks every time, but we will see after in the video. So this is with an evaluation with a 3D Antera of the presence of hemoglobin on the skin surface immediately after the fractional needle RF. As you can see a lot of hemoglobin because we have a bleeding just in the subdermal and in the dermis, because we don't have an ablative, so we don't have coagulation all the depth of the needle. So that's really important. So we will have some red pins on the skin, but this is normal and we can accept it. This is what we have usually. This is 5 minutes after, well, 24 hours, and after 48 hours we have scabs, but we know red pins that they are healing good. What is really important for a post-treatment? Cooling the skin. Wait 10 minutes, put some ice, something on the face or the area that we have treated. And after, when the patients go, we can put lenitive cream, emollient, topical like vitamin E, A, like I do, antibiotic ointment. And usually I say to patients, don't wash skin treated for 2 days, 1 or 2 days. Wait, and after you can do it, but it's better. And absolutely total sunblock screen cream. This is really important because you can avoid all hyperpigmentation problem. So now let's start. What we are doing? We are doing local anesthesia for fractional treatment in the lower mid cheek, and that is what happened. Look, I'm go in and do a little anesthesia. Well, I can give you my dilution. I use usually if I prepare 50 milliliters of solution, usually I do 20 of lidocaine and 30-40 of saline solution. This is really concentrated dilution. You can do less, 10 and 40, but you know, sometimes it depends from patients, but usually if you do lidocaine 2% and you do from 10 to 20 milliliters on 50, 60 of solution, this is good. If you want, you can add also 1 milligram or 0.5 milligram of epinephrine, but this is really a safe solution. We don't have any problem. Just don't do it too much concentration of lidocaine if you do on the neck treatment, because there is a great absorption of lidocaine, so you can have some problem about the muscles. And what happens is usually I do less, and I do 10 for 40, 50 of saline solution. These are my average, what I do. And now let's start with the fractional treatment. So that's why I'm doing, in this case, just not overlapping, but everywhere, because I don't need a big tightening on this area. I just want to promote the collagen, and you can see I'm doing only one pulse, and I'm going everywhere, just respecting sometimes the space. So this is a really easy treatment, so not so much, because this is why I tell you, I want to show you again. This is why, because I did, if you can see here, you can see the phase tight treatment and the acute tight treatment. So what I need is, don't do too much eating if you have this, if you want to use also fractional. So heating the subcutaneous tissue, heating the subdermal and skin. So don't do it too much. And that's why I'm doing only one pulses everywhere, and I'm not doing too much heating. So let's go, sorry. So that's why we call about 4 layers, because we have immediately the 4-zone thermal injury, coagulation, and this is not ablation, sorry, there is a mistake there. And this is 6 weeks after. This 6 weeks after, you can see starting absolutely collagen, a contraction of a tissue, and this is why. And this is the histological that you can see. So now, another treatment. Now you can see also 1 pulses and everywhere, not overlapping. But anyway, I'm doing 2 passages on this one. You can see they are going out, and this is the cycle mode, not fix it. So just a little, because this is not a great problem that she doesn't have so much. Another area where we can treat décolleté. This is great because you can treat more superficial. Well, now I'm showing just always 1 passage, because if you are not so advanced, if these are the first treatment that you are doing, start with a little energy and not so much positive. So what I told you before, 2, 3 passages and 2 stacks, this is the advanced treatment. So just the first treatment, do less, and this is better. Now we go just around the eye. This is a really important area where many times you don't know exactly what to do, and the fractional treatment. Now I will show you with a deep treatment. So I do usually 2 layers, 3 millimeters and 2 millimeters. You cannot do 4, because here you go to the bone with 4 millimeters. And usually I do 35, so less than what I told you. But look, now just in the lower lid, this is really important. Why I'm doing 2 layers and 3 and 2 millimeters? Because I want to have a coagulation of fat, because in this case, I don't have only skin, but I want to treat also the little fat bag that they have. And so that's why I want to reduce it. So I have a bulk coagulation, bulk heating of the fat. Now 3 and 2, and I cover the same area. Sometimes I'm rotating the probe, the device, so I want to do not the same holes. Now this is an experiment that I did, but we did just because they want to do only one size for the first time. And you can see that we have unilateral after 2 months. You can see that we have treated only the left side, and you can see that here, I want to show you better, is much better. This is 1 month, no, 2 months, sorry, yes, 2 months, maybe 40 days. Look, still little redness, but really better on the left side. And this is, again, I think this is less than 2 months. Sorry for, it's not 2 months, but maybe 1 month. And I did only one side because this was after a lower BLEPH, and said, okay, here there is more skin. Well, we treat only this one, but after, look, the skin was different. Now it's still redness, but it's good, it's better. And the patient asked me, please now do it the right side. Yes, and what we did. So we did 3 millimeters and 2 millimeters. I did 45 because I did more, and overlapping here. I did on the most deeper layer on 3 fixed mode, but just only 1 passages, and cycle mode on the superficial. More you go superficial, less energy, less pulses, and less passages. And this is the neck. Now you can see that I'm doing 3 stacks. 1, 2, 3, and this is in an intermediate treatment. You see the patient doesn't feel nothing. This is after a face type treatment, and I'm doing all the lower neck. And as you can see, I'm doing 3 stacks, 2, 3. The patient doesn't complain about pain, and I'm treating. But you know, I'm not overlapping too much because I did also before I did face tight and acutite, so that's why I don't want to make too much energy, too much eating on that skin. Now, the time sequence, what you can see before, this is the neck. You can see the skin is a very, very sagging skin, and this is after. Immediately after, you see the redness, but it's really homogeneous everywhere. You can see even here on this point is really less, as you can see, and this is great and this is good, but this is not the results, obviously. But after 3 months, the skin is better. It's much better, even if it's not perfect. Look at here and look at here. But I can show you that after 6 months, it will be better. And, oh, sorry. Let's go. And okay, see again. I want to show you the skin. I hope you will appreciate the skin, what I can show you just on the screen with this connection, but before was this one, and this is after 6 months. And this is a sequence after 3 treatment, 2 months apart, and we did. So what about acne scars? There's a lot of papers about the evaluation of a treatment of acne scar, but I am not doing that so much because I'm not a dermatologist, and so they go to dermatologists not from a plastic surgeon, but sometimes they ask me, some patients, and we have a good results about this one. But just about the hands of a plastic surgeon, I want to show you this slide. I can appreciate much better results on the lower lid that I did versus upper lid. So this is an upper BLEPH, and during upper BLEPH to these patients, I ask her what we can do on this lower lid, because I don't like. We do good, better results on the upper, but on the lower, oh, I don't want to do lower lids. Well, it's not so much, I know, but something for that skin. Can I do some Morpheus? Well, we will do it. And what now you will see is only one treatment, but 3 layers, 3, 2, and 1, 35 watts. And this is the photos is 1 month, and is true because you can see the upper BLEPH is not so good condition still. Okay, no, sorry. Okay. Go. Okay, that's why I tell you I prefer the lower lid results with Morpheus versus upper. Well, upper is good, but it's only 1 month. But you can see, and I want to show you much more zoom. Go. Now, please take on this one and look at this and look the scar, because sometimes you can find that I did a lower BLEPH. Look, this is not, there is not a scar. This is the skin. Please now look at the other one, and after one treatment. This is after. And look now, much better. The skin is tightened and there is a good retraction. And this is only one treatment. And that's why I'm really surprised about Morpheus power and not about my treatment upper BLEPH. And this is the lateral side. Again, look at this. Look at the amount of sagging fat, the little fat that's here, and now you can see here really less and good skin. This is what I like in Morpheus, a good effect on some kind of skin. Again, this is a lower BLEPH, but after I don't want to treat and to remove too much skin because I'm afraid to have an ectropion or a scleral show, and I remove a little skin, and after I do a treatment. So we have a treatment with skin, and so you can see the effect of, sorry, again, what I'm doing. Okay, yeah, but what I can do it. Okay, here, please, can you show? Okay, you can see still the scar, and that's why I show you the photos is 1 month or maybe more, but not so more. But you can see, what about the skin? If you remove too much skin in a lower BLEPH, this is maybe can have a great problem. But this is good because I did a little scar that will go, will fade away, but the skin is in a good condition. Again, this is a combination about Morpheus and filler. So this is a photo 5 months ago after we did hyaluronic acid, but we can combine all the treatment. Obviously, even this one, we can treat with filler and we can change the skin. Even these patients, you look at the skin and we can combine with a filler. In this case is calcium hydroxyapatite. So we have a production of collagen induced by the filler and collagen induced by the fractional treatment. So that's why the skin is really changing. Again, this is a combination with botulinum toxin. So sometimes you see the big platysmal band, and that's why we must treat before with a botulinum toxin. So usually I do 12 units for side for each platysmal band, and I'm treating, wait 20 days, 1 month, and after, when they relax, you can treat all the skin. And this is after 3 treatments, so this is after, well, 1 year, is good. Less platysmal band and the skin is much better. You can see, and I can show you, that's really, this is not a combination with phase tide or acutide. This is a combination with botulinum toxin. That's good. Again, this is with a phase tide, but we did phase tide just only on the jaw line, but on the neck we treated with a little acutide just on the upper, just below the chin in this area. But here I know that you cannot do nothing because we are over the thyroid, and this is a really attached area. It's very difficult. But with a fractional treatment, we can do it a lot of results, and that's why we can speak about better the skin. Now let's go to the body. Look, here is after an abdominoplasty, and now still some stretch marks and some sagging and creeping skin. So we are doing after, this is after 6 months, I don't remember exactly, after the abdominoplasty. But we did something like body tight, in you can see the small holes, and after on the upper abdomen, just above the umbilicus, above the belly, you can see the red tips of a, and I'm treating, so I'm doing better. And that's why After some treatment, you can have a better results with the skin of the abdomen. This is with acutite. So again, and this one again, usually we use for the subdermal the acutite. We treat all the area, and after we go superficial with the Morpheus. So we have a great results and a great improvement of the skin. What about contraindication of this treatment? Well, not so many, but remember, it's an electric device, so pacemaker, internal defibrillator, or permanent implant in the area, something like metal screws that the orthopedics do sometimes everywhere. You can ask to the patients, or silicone, free silicone. Maybe many people have some silicones injected. Pay attention, because you can have some side effects. Well, if they had an intradermal or subdermal previous treatment, HA, filler, something like botulinum toxin, wait that there is a complete reabsorption, because we don't know exactly what can happen, but usually we lose the effect. We lose the effect, because if I do filler and after I do radiofrequencies, I use it, I destroy some fillers, and this is better to wait. So obviously skin cancer in the area, pregnancy, and if they have a previous treatment like peeling, skin resurfacing with laser, isotretinoin treatment, everything about skin, or something else, well, wait some months to treat again, so to avoid some complication. Even don't treat area with tattoos, and if they had recent sunburns or sun exposure, wait that is going on. These are the contraindications. Now some other areas, and we are going at the end of this conversation about Morpheus. This is 3 layers, 45, 4 millimeters, 3 millimeters, 2 millimeters, 3 layers. No overlapping, one stacks, don't do too much. Remember, that's enough to have a good healing. Don't make overheating, over treatment if you want to have a good result. It's better to do more steps and less energy and less treatment. This is my idea. Don't treat too much. This is, for example, a treatment for the knees. This is always 3 layers. Now I like to do less, not more overlapping. You can see I'm going everywhere, but I'm doing 3 layers, 4, 3, 2 millimeters. I prefer, instead of doing overlapping only 1 layer, I prefer to do all the layers, so I'm treating everything. So this is no overlapping in one stack. You can see also a treatment about these knees. I think you can see that really creeping skin. This is horrible, because the patient has a great weight loss, and she came to me. She's my patient, say, what I can do, Paolo, I don't know to do it. Well, this is after 3 months, you can see better results, but not so much. But you know, this is really very challenging case. It's really difficult. And what I did is, well, overlapping, doing a lot, 45 baths and so on. But after 6 months, we had a surprise, because I waited. I did only 3 treatments, but after 6 months, look, the skin was a little better more. And now you can appreciate the difference from this side to this side, and just a little better. And you know that even they take weight, because if you can take weight, but you cannot change the condition of your skin, and especially in the knees. So that's good results about Morpheus. This is another one, just only the treatment of acutite, just in this area above the rotulas, the patella, sorry, and the treatment of the skin. What about arms? Arms is one of the most requested area. All the women said, oh, please look my inner arm. What is that? And what I'm doing. Yes, this is what we do. 1, 2, 1, 2, 2 stacks. All the passages are usually for 45 watts. and I'm treating all the area that I have marked. Sometimes I can have a combination with some filler, and usually I use the hyperdiluted calcium hydroxyapatite after the treatment. Before I want a tightening of the skin, and after I put something to have more elastic skin, and sometimes because it's too empty skin, and that's why I'm doing it. Now I want to show you what happened, because usually here I'm really one area I want to be uniform on the skin, because here you need a lot of energy, and that's why this is what I do. Look, the tip is going everywhere, overlapping, and I'm doing all the area is with red pins. Red dots are really homogeneous, and this is the uniformity, and so this why you can have a result. This is one of the results that's really good, because the skin is less. This is without any adding. So that's why this is the second case, and this is another one. You can have a great result just to do 2 layers. Usually I do 3 and 2 millimeters, and I do 3 treatment. But usually I do 45 watts. This is photos of post-op. Now, to finish the side effects, what I've seen. Well, not so much. I don't think it's a great side effects I have. This is what I have recently. This was my mistake. Maybe she moves because she had pain. She moved, and maybe I'm burning on the skin. But you can see after 1 week, after 1 month is healing good, and now she called me that it's better, and this is why. It's not a complete all depth burn, but it's only superficial burn. But you know, sometimes can happen. So the erythema is long lasting. Sometimes the red dots last more than 10-50 days. Sometimes I had few people that had for 1 month red pins. I don't know why, but they heal, they go away. Swelling is very infrequent, but sometimes you can have, usually in periorbital area. Crust and blister and burns, but usually, you know, we have restitutio ad integrum, so they heal completely, they fade away. And hyper or hypopigmentation, really rare. I never seen, but I think is really much more frequent in the Asian people or in the black people. So the skin Fitzpatrick type 4, 5, 6, and maybe could be more frequent there. Well, finally, we would like to thank you for your trust in these challenging times. The health and safety of all of us always remain our highest priority. This is power, poor Italy. Thank you, InMod. Thank you, InMod, to continue to support our nice job, and especially thanks you for your attention, and happy Easter to all of you. Now I'm ready for some minutes if there are some questions. I don't know, Judy.
Yes, you hear me? We have some questions. We have a lot of questions, actually. Let's start. You ready?
Yes.
Thank you, first of all. Okay, so first question. What is your experience with patients who have rosacea? How is your experience? Have you experienced the improvement after procedure?
What about? Sorry, I didn't understand.
Patient with rosacea.
Rosacea. Well, I didn't treat a patient with rosacea, but we have a good improvement sometimes when I'm treating, and I see sometimes some little vessels, some telangiectasia, and I see there is you can close because the heating is doing a good job on the small vessels, and you have a good result about this small telangiectasia. But I didn't treat it about rosacea. I don't have any experience about this one. But I tell you, when I'm doing face and they have small telangiectasia on the faces, they reduce and they close their vessels. So that's good. The heating is good, because usually this is what we do for this problem.
Thank you. Another question. Which kind of topical anesthesia do you use?
Well, I used all the topical anesthesia that you can see in the world. I've tried even from some topical cream that you can find in the pharmacy. I used some self-made from some pharmacists, and they have lidocaine, tetracaine, and pilocarpine. So they usually mix 20%, 10%, 5%. So I tried many. I think I can tell you I tried 20 kinds of topical anesthesia. But my really experience is every time, sometimes they feel pain. I don't want that they feel pain because they need to come 3, 4, 5 times. That's why I say I want that they don't complain about pain. They do a treatment very safe and no painful, and that's why I'm doing local. But local for me is really important, just for safety, not burning, and for spreading more. So that's why I prefer, and it's much faster because in 5-10 minutes I finish all face and neck. With topical I need 40 minutes.
Okay, thank you. What is the protocol to follow for stretch mark?
Well, for stretch mark is really a big tip. I'm waiting, maybe InMod, and Judy, maybe you know, is coming out maybe a new tip, just very narrow.
Yes, very soon.
Yes, very thin, so you can treat better because you can follow all the stretch marks. Usually when you do with a large tip, you can treat more, but you have a contraction of the skin. I cannot show you this one because I have some photos, but it's really difficult to show the stretch mark. Maybe I can show you with Antera results, but not with photos because it's not, you know, it's really difficult to appreciate, but you can have. And if the narrow tip is coming out in the next month, well, maybe it could be better because it's less invasive, because you don't want to treat all the area, but just only the stretch mark.
Yeah, I think we will have it in the next couple of months. We will send you all the details. We have a question from UK, from Hannah. What is the penetration depth would you use for décolleté?
Well, please don't do it too much deep. So usually I do two and one, 2 layer, and is enough. I don't go more than 2. It's a really superficial treatment. Well, I have not spoken because I have not had great experience about resurfacing tip, but you can do it sometimes even resurfacing, but usually you can use it on periorbital and on the barcode on the perioral wrinkles, but usually you can do it also on the décolleté area.
Okay, thank you. Yeah, we have more. People are enthusiastic. What is the contraindication in pregnancy? And how about breastfeeding?
Well, even it's not a absolute contraindication in the pregnancy. Usually I say, please don't do nothing, even because if I do local anesthesia, so anyway, in the first 6 months, don't do nothing. But usually it's better, you have some other things to think in this period. So usually I say after, because after you have some problem about skin, usually on the abdomen, the stretch marks and all the skin, and this is a good period after. But wait after pregnancy, after 6 months, because the skin must adapt and changes, and after you can do it.
Okay, how long do I have to wait with Morpheus8 after hyaluronic acid?
Well, usually depends from what kind of hyaluronic acid, because if it's IG prime, usually stay long, 6-8 months. But usually just the patients ask me, because sometimes if you find some patient that you do usually the treatment, you say, okay, if we want to start a treatment with Morpheus, first I'm doing Morpheus. And first I'm treating, I'm contracting, I'm tightening the skin. And after I will do hyaluronic and everything. But if she has, okay, wait the complete reabsorption. Well, usually after 6 months, I can do it. But it's really important to know that when we are treating, sometimes you can inject hyaluronic. Usually I do hyaluronic acid immediately after the treatment, and you have a better healing because you have an hydration of the tissue. You can, I don't know what are the support, the scientific ratio about this one, but usually when I do hyaluronic acid, usually superficial and low G prime hyaluronic acid, well, it's good healing. They have just for a few days red pins, and they will go better.
That's great. We have a question about, 1 second. For treating eye bag area, do you use double stack for 3 millimeter, 2 millimeter, and 1 millimeter?
Yes, no, usually I do only on the 3 millimeters layers, 2 stacks. And more superficial I go, less energy and less stacks. Usually on 2 millimeters and 1 millimeters, absolutely, I do only 1 stack.
Good. We have a question about PRP. Can we use PRP directly after Morpheus8?
Absolutely, absolutely. Could be good. Could be better healing. Better is good. Remember, we are doing a treatment, and we must do sometimes a combination. When we do combo treatment, this is better. 1 and 1 is 2. So yes, it's good. I did sometimes, nano fat after, and was really good, was better, absolutely. So we use all the stem cells and all the factors, angiogenesis factor, all the what we have in the fat, was really better healing. And so that's why even PRP is better. You have a good results.
That's good. How much energy do you use in the periorbital area, Dr. Rovatti?
Well, sometimes if I want to reduce the little fat bag, usually I go on 45 just on the free layer, if you have free layer. Usually if they have fat, you can have 3 millimeters. But when I'm going upper, usually I do 45 on the 3 millimeters and 35, 30 on the 2 millimeters. If I do 1 layer, 1 millimeter, sorry, I'm doing less. Usually I do 25 and 1 stack, so less, because you remember on the superficial you can have burns or much more if you do many layers. If you do only 1 layer, you can do 35, but if you do many layers, remember, more superficial you go, less energy you have and less stacks. This is my experience.
And you have an experience, eh? Why don't you do overlapping, someone is asking?
Well, overlapping is a good way to have great results, so for some areas. But if you are going on the body, it's not really so important because you cannot cover all the area. So that's why I don't want to have a great redness, a great erythema, and so that's why I do overlapping on the area where I can have a good result on the skin, and so usually is where the skin is a thin skin. So I can do overlapping on the neck. This is a good area where to go at. But if you are going on the lower lid, you can overlap, but not so much. 30%.
That's good. We also have Dr. Enrique, who's saying that it's really interesting in the same session to do different depths in the same treatment area. His recommendation. Yeah. We have Dr. El Cordi, who is saying that it's amazing result and is wishing you all the best, Dr. Rovatti.
Thank you.
Another question from Dr. Al-Sarf. Do you prefer to do Morpheus in 2 steps for the face?
No, usually I prefer to do Morpheus in 3-4 steps. No, usually 3 is my number. 3 is a perfect number. But usually I do 1 treatment, and after 2 months, the second treatment. But the face, well, I can do it all the face if you have a sedation, because it's really difficult. Because if you do the forehead, my God, it's very painful. And so maybe you can do if you have sedation, if you're doing in a surgery, during the surgery. But if you want to do all the face, and if you can do with a topical, with local, you can do it. You can do it. Why not? But usually all the face you can do it, but 1 treatment. And this is not enough, remember.
Thank you. We have a question from Dr. Dimitris. What if you already done acutite on the lower lid? What's the energy of the Morpheus then?
Well, depends if you are treating in the same treatment. So if you did acutite, well, stay with very low energy, because you did a lot of energy. And so usually if I do acutite before, I do 25 with Morpheus, and I do just a little treatment, not overlapping, and just only 1 or 2 maybe layer, but usually 1, not so much. And usually the energy of a Morpheus, if I do in the second step, when I'm doing only, I can do more than 35, but not more than 35. It's really difficult. I do 45 on the lower lid. Usually I stay less. I prefer more steps with less energy, but less steps with big energy.
Thank you. Last question, I think. Can you please clarify the difference between the cycle mode and the fixed mode?
Yes. If you take some heating device and you go in, you give energy, and you go out, you have less energy. So that is a medium treatment. But if you want to have more energy, is fixed. Fixed means go in and stay in. And while I'm staying, I'm delivering more energy. That's why I use fixed sometimes when I need more effect on some very thickness skin, when there is more depth. So usually when I want to do on the body 4, 3, 2 millimeters, I use fixed for 4 millimeters, 3 millimeters. When I go up, just only cycle mode. So remember, when you go up, go less energy, but fixed and cycle, the main difference is that I'm doing more energy and more effort on fixed mode. So you decide, you see the skin of the patients, the thickness of the skin of the patients, and you decide what to do it. It's like you have a gun or a fire gun. So you need to what to do. You choose the energy. It's not only the watts, it's also the mode that could be different.
Well, I think this is it. Thank you, Dr. Rovatti. Again, amazing job, amazing results. We want to see it more and more. Thank you, everybody, for joining us. Enjoy Easter, enjoy holidays, stay safe, stay home.
Yes.
Take care.